D. Stertorous respiration. Stertorous respiration. So for unconscious patient, we always exhibit with stertorous respiration. Stertorous respiration means harsh snoring. And harsh snoring is mostly seen with unconscious patient. So we have defined all of the options. The option that resembles that question is D, which is stertorous respiration. It is harsh snoring, mostly seen with unconscious patients. Are we there? Are we there? Next question.
Question 3. Emphysema is an abnormal constitution whereby
Emphysema. What is emphysema? First of all, what is emphysema? What is emphysema? What is emphysema, please? Emphysema is a pathology of which system, first of all? It should be a pathology of the respiratory system. What is emphysema? Yes? Is that emphysema? What you are doing it is imbibe. Don't confuse with the two medical terms, please. When you talk of emphysema, it is simply a situation where there is a destruction of the alveoli. When the alveoli have been destroyed, it reduces the surface area for gaseous exchange. This surface area that has been reduced causes the patient or the individual not to breathe normally. What is the cardinal sign of emphysema? It is, I repeat again, emphysema is a situation where there is a destruction of the alveoli. This destruction leads to a decrease in the surface area. This decrease in surface area reduces gaseous exchange. It means the patient cannot breathe normally. Since the patient cannot breathe normally, the patient will be using associated muscles to breathe. With this slide, since the patient is using associated muscles to breathe, the chest of the patient will be round. We call it the barrel chest. So if they ask you receive a patient in the medical surgical unit experiencing with barrel chest, it should be emphysema. Barrel chest means round chest. The patient is exhibiting barrel chest or round chest because of decrease in surface area, which reduces gaseous exchange. Means the patient cannot breathe normally. The patient now use associated muscles to breathe, causes the chest now to become round. Are we there? And this gaseous exchange, or what causes this patient to breathe normally, is because of the presence of a chemical called surfactants. That is why they always ask you in pediatrics, why is it that a newborn will breathe faster? At one point in time, the newborn is not breathing if you look critically. The newborn will not breathe, the newborn will breathe faster, and at one point in time, breathe ceases because of the chemical surfactants. Because when a newborn is being born, this chemical is at a deficit. This is a question that came 2024. They were talking of respiratory distress syndrome. What causes respiratory distress syndrome? Give the pathophysiology of respiratory distress syndrome. So the pathophysiology of respiratory distress syndrome is simple. It is just because of the deficiency of the chemical called surfactant, because it is a chemical that helps to increase gaseous exchange, or that helps to increase the surface area for gaseous exchange. So with infants, this chemical is little, or it is small. Since it is small, gaseous exchange is very difficult for infants. That is why an infant will breathe faster at one point. At one point in time, you look at if the infant is not breathing because of this chemical. And this chemical is produced by which cells? We actually now in basic sciences, precisely pharmacology, anatomy and physiology. Surfactants are produced by which cells? They are being produced by the pneumocyte cells. The pneumocyte cells produces the chemical called surfactants, and the chemical called surfactants helps in gaseous exchange. So emphysema is simply the destruction of the alveoli, which help to diminish gaseous exchange at the level of the alveoli. That's all. So they are saying that emphysema is an abnormal condition whereby A, there's pus in the lung tissue. Is that? So you cannot take that. B, there's residual air in the lungs. B, there's residual air in the lungs. C, there's maturity of gaseous exchange. G, none of the above. What is the answer? Read B. There is residual air in the lungs. There is residual air in the lungs. When you talk of residual air, what does that mean? When you talk of residual air, what does that mean?
After normal exhalation.
This air is in the lung after. When I said emphysema is a problem where there is destruction of the alveoli. And we know that the function of the alveoli is for. Since the destruction, air will not go out. That's why we talk of residual air in the lungs. The air cannot go out because of the destruction of the alveoli. So the answer should be residual air. Are we there? It should be residual air. Are we there? Good. The next someone should read this.
Question 4. Chronic peptic ulcer can be one of the commonest illnesses adults
Good.
suffer.
You start from there. So the key term here is peptic ulcers. What are peptic ulcers? What are peptic ulcers? How can we differentiate between peptic ulcers and gastritis? Please. Who can differentiate between peptic ulcers and gastritis and even jet? What is the full meaning of jet? Disease. Gastric esophageal reflux disease. Who can differentiate between peptic ulcers with gastritis and gastritis with jet? Yes? Peptic ulcers are wounds in the GIT. It is not only in the GIT. I said it again. It is not wounds only in the GIT. We received a patient yesterday that was suffering from peptic ulcers, but it was not in the GIT. The patient came with an HB of 2, 2. Because of hematemesis. What's hematemesis? The patient was just vomiting blood. The patient vomit blood and immediately they arrive at the emergency. They call the intensive care to come and take and they send the patient immediately to the rehabilitation unit because it was bad. So in the hospital, when the patient comes and the emergency cannot handle, they must send it to the rehabilitation. That's the last ball stop in the hospital. If the patient does not get well, then the patient must die. So we need to, when this patient comes, we need to reanimate this patient as fast as possible because the saturation was 80%. Why was the saturation going down? You can explain. Yes? Decrease in blood. Decrease in blood. And we know that hemoglobin is a carrying capacity of oxygen. That's why it's going down. And what do you need to do? You need to what do you need to do? The management. You administer oxygen and how many liters? Should be from 6 to 8 liters. Which type of mass? We'll start with the nasal cannula. Nasal cannula is a small rope that you put right. You start with it. You start with it and you monitor the saturation. If you monitor the saturation and you discover that it ends only at 90, it means it is not sufficient. Because the normal range for saturation is what? So when you put this, it does not go. You need to change the mass. Which mass are we supposed to take down? All of you have done reanimation. Which mass? We'll take the Venturi mass. And when you take the Venturi mass, it does not still give a saturation of 90. You need to change again the mass. Which mass are you supposed to take down? The non-rebreathal face mask. That is the stop. When you give the non-rebreathal face mask, which is capable of producing 15 to or 20 liters and above in a minute, you give. When you give this oxygen, the next should be what? Blood transfusion. So I'm saying that peptic ulcer is not only at the level of the GIs. So what talk of GIT will mean? What is GIT? Gastrointestinal tract. So gastrointestinal tract means what? Gastrointestinal tract means what? Because for peptic ulcer to take place at the level of the esophagus, come before coming down. So this patient was having peptic ulcer at the level of the stomach. So we say peptic ulcers are wounds that you get or wounds and the lining of the stomach, the lining of the esophagus. Peptic ulcer is a complication of what? Gastritis. What is gastritis? Inflammation of the. What is gastritis?
Inflammation of the gastric mucosa.
It is inflammation of the lining of the stomach, which come as a result of what? If they ask you to give the pathophysiology here, what's the pathophysiology of gastritis? How does gastritis come about? What is the pathophysiology of gastritis? Yes?
So during starvation,
During starvation, one of the factors, yes.
if the patient perceives maybe the scent of food, signals will be sent to the brain for the production of gastric juice. These signals will return to the stomach, which will make gastrin a hormone which increases gastric juice production in the stomach to reduce excessive gastric juice, which when it does not meet any food, it starts eroding the stomach lining.
Yes. So we are saying that for gastritis to come about, you can be exposed to a trigger factor like starvation. Most of you that's fast. Because this patient was a Muslim, and it shows that he has fasted for long before developing this situation. I'm not saying that you should not fast, at least eat something. Now, it can be because the person starves, and when you starve, what happens? The parietal cells of the stomach will be stimulated to produce a hormone called gastrin. Gastrin now will come now to produce hydrochloric acid. Hydrochloric acid now will come to erode the walls of your stomach, exposing you to gastric. Now, when gastric again can be caused by a bacteria called what? H. pylori. So when maybe you are in the hospital or in a clinic, you want to consult a patient tells you, I'm having pain at the level of the epigastric region that radiates to the back. It should be gastritis. It should be gastritis. That's why you must put the test H. pylori to test for it. Now, what is jet? What's the cardinal sign of jet? It's a question necessary to ask you the cardinal sign of jet. What's the cardinal sign of jet? Yes?
Backward flow of gastric contents and the stomach.
Backward flow, and this will cause the person to burst. So when you're beside somebody that always the person is suffering from jet. And which type of medication can we give to this situation?
Antacid.
We give?
Antacid.
Can we give antacid for peptic ulcers? We cannot give antacid for peptic ulcers. We can give antacid for jet. What is sickle cell? Yes.
Sickle cell is a disease caused by gene mutation whereby the red blood cells are abnormal in shape and die before lifetime.
Yes, now we need to know the shape. How is the shape of the sickle cell? It should be Christian. It should be Christian. Now that's it. A sickle cell disease in term inherited blood disorder where the red blood cells has a bioconcave. Should it be bioconcave? B, biconvex. C, the Christian shape. Z, none of the above. So the answer should be C, the Christian shape. Read.
Question 6.
Yes.
Diabetic coma is seen as one of the most dangerous complications of diabetes mellitus called
Diabetic. I hope all of us can define what diabetes is. Are we there? Can we define diabetes? Can we differentiate between type 1 and type 2? Good. If we can differentiate, continue. Diabetic coma. Good.
Diabetic coma is seen as one of the most dangerous complications of diabetes mellitus because A. Incomplete fat metabolism.
Incomplete
Fat metabolism.
fat metabolism. Okay.
B. Hyperglycemia. C. Diabetes due to obesity. D. None of the above.
What is the answer to this? diabetic coma is seen as one of the most dangerous complications of diabetes mellitus because we say A, incomplete fat metabolism, no. B, hyperglycemia, we know what hyperglycemia is, right? High level. C, diabetes due to obesity. D, none of the above. What is the answer? Okay. What is the answer, please? B is hyperglycemia. So you are saying that diabetic coma is seen as one of the most dangerous complications of diabetes mellitus because of hyperglycemia. No. With that hypoglycemia is more dangerous than hyperglycemia. Hypoglycemia is more dangerous than hyperglycemia. So low level of sugar is more dangerous than high level of sugar. So what can be the answer?
Diabetes due to obesity.
None of the above. Are we there? It should be none of the above. It is not hyperglycemia. No. This is with high blood pressure. Hypertension is more dangerous than hypertension. Like if you receive a patient having a BP of 50 or 40, this is what? This is hypertension. You as a nurse, what can you do as fast as possible? You receive a patient in a clinic that you work and maybe you are the only nurse on duty with this BP in the night around 3 a.m. What are you going to do? That's why we are saying this profession that they have chosen, you should only work with that profession. I believe at the day that you will be graduating, you will maybe some candles that you are going to put your wish on those candles. Never you kill should be your priority. And you are going to take a lesson called paragraph 3. You should know the importance of that. Some of you, a patient will come just because of negligence, the patient dies. If you know that you will not be able to reach to the task, please leave the lesson apart. Go and sell in the market. If you receive a patient with this BP, how are you going to do? That's lesson science now. With fluids. You give saline. Saline should be the secondary, but the primary should be. There's something I need to do. What are you going to do? Positioning? No. You must give dopamine, vasoconstrictors, or vasopressors. Example, you can give dopamine, you can give noradrenaline, you can give ephedrine. These are the drugs that I'm giving. When you give something like noradrenaline, it should be maybe 8 milligrams inside 500 cc of normal saline. And when you give, make sure you monitor the BP and all the time, because the BP will build up. You should not be at a certain somebody can have hypertension. You again put the patient into hypertension. So all what I'm just saying is to tell you that hypo is more dangerous than hyper. The next.
From all indications, recommended position to nurse the elderly sick hypertension and diabetes should be A. Recumbent position, B. Fowler's position, C. Lateral position, D. All of the above.
How many Fowler's position do you know? I'm not getting No. It should be 4. Why do we place a patient on the Fowler's position? Why? To ease respiration. So we have the first Fowler is we have low Fowler's Low follows is from how many degrees? Huh? I'm not guessing. It should be 15 to 30 degrees. Fowlers should be 32 degrees. Semi-fowlers. No, these semi-fowlers should be 45 to 5 fowlers now should be 60 to 90 degrees. So as you are being sitting like this, you are at the high fowlers position. So a patient with from all indication, the recommended position to a nurse, the elderly sick hypertension and diabetes should be from all indication, the recommended position to nurse, the elderly sick hypertension and diabetes should be what? Which position? Should be which position? Should be which position? Should be lateral position. Is lateral there? I know the people that said lateral position is a recovery position. Is that not what you said? The one is that you are looking at and you are looking at me. You said lateral position is a recovery position. And somebody is suffering from an elderly suffering from hypertension and diabetes. You must put the patient in a recovery position to prevent hypertensive coma or diabetic coma. Read the next.
A child of 6 years was brought to the hospital for drinking a corrosive liquid. What do you think administered as the first aid treatment? A. Emetic. B. Digestion. C. Antacid. D. Antibiotic.
Yes, what can we give?
Acid.
Huh?
Acid.
The point is to understand. The patient has taken what? Corrosive agent means something that is acidic. Are we there? Something that is acidic. And during your knowledge in the high school, what is now of? What is neutralization reaction? Basic techniques, lab, yes.
Neutralization reaction is a reaction that occurs between an acid and a base.
An acid and a base. Are we there? So when an acid plus a base is going to give what?
I don't want you anymore.
Comme ça.
I don't want you anymore. I don't want you anymore.
So we are saying that when an acid, for example, you have hydrochloric acid plus a base such as sodium hydroxide, when it combines, when it produces what? Sodium
Chloride.
is going to produce chloride, salt and water.
If you do sodium chloride,
It's going to produce
sodium chloride.
sodium chloride plus. So this is what happens if you take a corrosive agent. Now when you take a corrosive agent, it is an acid. Now what can you good, next question.
So now the linear is termed strangulated when
What is strangulated? What is strangulated in you? What is strangulated here? What is strangulated? Strangulated means what? Means what is strangulated? They have died. Means the cessation of blood flow. You discover that strangulated, when you look it very well, you discover it becomes black because there's not oxygen. It's now twisted. Since it has twisted, there is cessation of blood flow. Now what is hernia? If they ask to write short notes on hernia in necessary answers, what is hernia? What is hernia? Yes?
It is when an organ protrudes to another organ that was not meant to be.
Yes. Hernia is simply when an organ leaves its original cavity into another cavity through a point of weakness. Forget that. This is a cavity. It moves here. We call it hernia. When an organ leaves its original cavity into another cavity through a point of weakness, we term it hernia. And we have seen many types of hernia. Example: Hitia hernia. Hitia hernia is being seen in this system. In the digestive system. The Hitia hernia in the digestive system. Another type of hernia. Inguinal hernia, umbilical hernia, etc. So let's read.
the linear is termed strangulated when A, the body is bulged, B, there is constriction at the point, C, there is constriction at the point.
What is the answer, please?
Intestinal blockage. Intestinal blockage.
C is what?
Intestinal blockage.
There is constriction. There is intestinal blockage. Are you sure? There is constriction at the bottom. What is the answer? We said when they say something is strangulated, maybe the thing has twist and there is cessation of blood flow. Now, what is the meaning of strangulated? What is the meaning of strangulated now? Is in death flow of intestinal content. No. When talk of intestinal content, what are the intestinal content I know? Stool are intestinal content. Blood is not intestinal content. Blood is found inside the blood vessels, and the intestine is not one of the blood vessels. Are we so intestinal content is wrong. It cannot be intestinal content. Because we know the components that make are found inside the intestinal content. I spoke of stool, it's found in the intestine. In the case of umbilical hernia, it is not stool, it is not still it's not because you are talking of intestinal content. Intestinal content we talk of stool. Umbilical hernia, it is the same. We said movement from this because to detect umbilical hernia is simple. Send your hand at the level of the nerve root, and you're going to feel a hole. That hole is a point of weakness in which the intestine have moved into another cavity. So intestinal content is not blood. Blood is found in the blood vessels. So it is not intestinal content, no. Constriction of the what? Constriction of the content. What's the content? When I talk of constriction of the content, it is not blood. It is not blood. Are we there? It is not blood. Constriction of the content. They talk constriction of the. There's constriction at the content. No. It is not the answer. The body is washed. That's the answer. The body is washed. The first one, let's explain this. The B part, this one of what? There is this constriction at the content. Which content are they talking about? This constriction at the content. I explained to you that strangulated, they are talking of blood. So if they explain that strangulated or constriction of the blood, that's a place that they put most of the thing. They say constriction of the content. Which content are they talking about? That is wrong. See? There is that is intestinal blockage. So when you have hernia, is there intestinal blockage? Intestinal blockage comes with as a result of appendicitis. Are we there? So the pathophysiology of appendicitis is simply when. Now when we start talking about intestine, we are talking of intussusception. Intussusception is what? When the intestine telescope the order or the intestine struggle to enter the order, it is another emergency. It's mostly seen with children from 1 to how many years? 5 years. And what are the manifestations? The child will start crying, sending the legs up like this. So when you have a child, see, the child is dragging the legs up, start suspecting intussusception. When the child again have current upper respiratory tract infection, like common cold, you suspect that. Then when the child now start sending out bloody stool, that is, you need to, the only solution now is surgery as fast as possible. Read the next question.
So then, intussusception is a surgical complication whereby A. There is an enlargement of the intestine. B. The narrowness of the lumen of the intestine. C. Invagination of one part of the intestine into the lumen of the immediate.
So what can be the answer?
Bruises can be classified under A. Punctured wound, B. Lacerated wound, C. Incised wound, D. Abrasive.
It should be example of a punctured wound. The wound got it from what? Gunshot, blown knife. And this type of wound are going to heal by which type of intention? What is first intention? What is second intention? What is third intention? And what are the steps of wound healing? What's the first step of wound healing? What is the first step of wound healing? What is the first step of wound healing?